Thank you to the Clinton Global Initiative. Ladies and gentlemen, the nexus between health and climate was strongly recognized by the parties at COP28. And this recognition would not have been possible without the incredible leadership of allies like Healthcare Without Harm.
Near Climate Week, at the Clinton Global Initiative annual meeting, we made a commitment to action with the UNFCCC high-level champions to double the number of member institutions of Race to Zero.
The Race to Zero campaign is the world's largest campaign of real economy leaders taking action towards net zero to help halve emissions by 2030. And thanks to the commitment of Healthcare Without Harm, many of them are healthcare facilities.
We already have about 70 or so institutions that are members, and we will be doubling that number. Right now, that represents 14,000 hospitals and health facilities around the world who have committed to this.
The world's health facilities are on the front lines of the climate crisis. That is why today I would like to invite Healthcare Without Harm to also work with us under the Race to Resilience campaign to recognize and strengthen the contribution of all your members to enhance resilience.
The second part of our commitment today, with your help, is to build healthcare climate resilience to safeguard the health of over 100 million patients served by our members. This means enhancing the ability of our hospital and health system members to adapt to the climate crisis while embracing climate mitigation and sustainability.
We've been doing this work for a long time with hospitals and health systems, helping them to decarbonize, to become more resilient, mobilizing leaders around the world to show the way. And our partnership with the UN high-level climate champions, Race to Zero and Race to Resilience, has helped move this work forward.
Healthcare Without Harm has been absolutely instrumental on having this Race to Zero. I used to tell them Race to Zero for carbon means 100 for health. So this collaboration and convergence of the two targets is fantastic.
And so for us to come together, Race to Zero, Race to Resilience, the UN high-level champions and Healthcare Without Harm, to announce this commitment to actually build on this work and make it bigger and stronger and better is just super exciting.
The health of people and the health of our planet are inextricably linked. Today's commitment is about protecting our hospitals. Today's commitment is about protecting our doctors. Today's commitment is about protecting our nurses and families. Our commitment will require dedication. Our commitment will require collaboration and resourcing.
We need to decarbonize healthcare. Healthcare represents 4.4% of the global greenhouse gas emissions, more than aviation and shipping together. But beyond that, we need to ensure that we reimagine healthcare systems. Healthcare systems are very used to just treating people when they're sick. But we need to reimagine that and focus on prevention and resilience.
Race to Zero is a very strong commitment for Albert Einstein. It's more than a paper. It's part of our business because healthcare and environmental must be working together to provide for we all a best life quality.
We need to develop tools and guidance for health facilities to be able to do this. And that means that we need the people behind it, the resources behind it, and the technical know-how in different regions. We believe that this initiative will actually need an investment of about $13 million. We think that that investment will leverage hundreds of millions of dollars. We have already been able to secure $4 million for the next few years, but we need about $9 million to be able to make it happen.
We invite all of you to support Healthcare Without Harm in mobilizing climate action through our Race to Zero and Race to Resilience campaign. Please do help us achieve this incredible vision of healthy people on a healthy planet.